HIV disease appears more rampant among the male population than that of females in Grenada. With increased testing, it is hoped that the disease can be totally eradicated by the year 2030.
So notice though is that over the years the amount of new cases of HIV has started to drop. From 2015-2016 to now 2019, we've seen a decline in the number of new cases. We went from 47, I think, to 37 or 36, then 27, and so far for this year, we've had 22 cases, which speaks well to our national program, because while in the face of increased testing, we're seeing less new cases. So it definitely says that we are on the path to be able to end AIDS by 2030. What is interesting though is that more women are coming out to be testing, but more men are positive for HIV, and that's a very worrying sign.
The age range testing positive for the virus spreads across the board. Dr. Martin says from babies right up to elderly persons. However, there are some positives stemming from the maternal and child health programs where there have been zero mother-to-child transmission of the HIV virus for years, except for one case within the last 2 years due to the mother's refusal to accept treatment. However, there are some disturbing developments he mentioned as it relates to the spread of the HIV and AIDS virus.
But we're also noticing that the younger populations are getting, just like with most of the other diseases, most of the other chronic diseases that we know, we're seeing a very unhappy trend that younger and younger people are becoming positive with HIV. I must also say that there are very worrying reports of people who deliberately get sexually involved with someone knowing fully well that they're HIV positive. These people must understand that we will know who they are, and we're going to deal with them in the most profound way possible.
The medical doctor says their efforts for 2020 will be focused on encouraging people with the disease to accept treatment and others to continue getting tested. Treatments are available, he says, at no cost to patients, but not enough people are taking advantage of that treatment. Dr. Martin believes one of the reasons is that of stigma and discrimination people still face. What Dr. Martin wants people to remember is that while attention is placed on HIV and AIDS, other sexually transmitted diseases are creeping up due to lack of attention. Their plan is to address both HIV and AIDS and STI and STDs at the same time. Testing was done over the weekend at different locations throughout the country. World AIDS Day observed on December 1st under the theme Rock the Ribbon, which encourages people to wear a red ribbon to show everyone, especially people living with HIV and their families, their support. Chrislina John, GBN News.